Fire is in the patient. Oh boy. So again, now this is a little bit of a higher risk. They have to cut the gases off. They have to disconnect. They pull the tube out. For our scrub techs, you're gonna have to bring the bowl of saline over to them. Okay, unless there's like an anesthesia tech in the room, if you have that as an option, you can give it to the anesthesia tech. Flushes, again, they may be able to get back in there and reinsert another airway or LMA. And if they can't do that, then they have their emergency procedures and they have their second options, things like that, okay? Any questions on that? Okay. Here's what it looks like if we actually have an airway fire. Again, high risk. Some anesthesia providers actually fill the balloon with saline to prevent that fire from at least igniting. And it does, you know, if there is a hole somewhere as well, it, you know, obviously will leak out and they can notice that. Again, fire on the patient, we're going to talk about this. You know, we have a bunch of different options that we have available to us. So for those of you that have never seen this before, this is what we're going to practice today. Okay, so again, we're sweeping, we're not padding. Now, the items that we're using today are flammable. They will burn if we do panic, so we don't want that to happen. Okay, fire in the room. Please don't take that piece of equipment that's on fire and push it out into the hallway, okay? Because if the fire gets hot enough, sprinkler head's gonna activate and now we're trapped in the room. Now we're forced to stay. We don't want that either. So we're gonna leave the room. Now there are some simple things again that you can do. The fire extinguisher is available. If you can unplug it, if you can turn it off, you can do all those things safely, fine, you can do that. But it's again, when the fire alarm activates, the ventilation system cuts off, even in your room. And so the smoke is just gonna hang out there. So it's, again, it's not a safe place for us to be. So we're gonna leave that environment. You've all heard of RACE before. We're just gonna use that as an opportunity to get out of the room. So what's your role during a fire? Our circulators, okay? Again, loudest voice in the room. You need to notify somebody. So who do I call? Please don't tell me Ghostbusters. Who should I always call when there's an emergency in the room? Right, let them know what's going on. I mean, even if it was like from a laser or a fiber light, it was just a small burn hole. Hey, we had a small fire, okay? I can't tell you to not activate the fire alarm system, so you're always required to do that no matter what, but that doesn't mean that you have to evacuate. It was a small fire, yep, we got that whole process started, yep, we did have a fire, right? You got nothing to hide here. As a matter of fact, if you do try to hide it, you're only gonna get in trouble anyway, even further, maybe even worse. So, you know what? Activate the alarm. You'll never get into trouble for that here, okay? So at this point, we're gonna call, if you can't find the core person, if you can't find the individual that's in charge, right, you're gonna have to start making some of this happen. You're gonna have to call the switchboard so they can do overhead paging. You may have to find the pull stations. When we get into your environment, if you don't know where the pull station is, it may not be as obvious. Throughout your time here today, I'm not saying you need to do it like right now, but throughout your time, like you're going to break, you're going on lunch, you're down in the hallway, look for the pull stations, okay? It's not as obvious as you might think. All right, so at this point, you're gonna get the table to wheels. That is the preferred method unless we're in like a cath lab or something where the bed just doesn't move. Don't mess with it if it won't move, right? Like, because they're really not meant for patient transport. Don't mess with it. Just go out, get the cart, bring it back in, transfer the person over to get them out of the room, okay? Now with that, if you're scrubbing, you're there to help surgeon, whatever they might need to provide care for the patient. Any instrument that you may need, IO band, cover the surgical site with a very simple dressing or a sterile dressing. Again, because you're leaving and you may be finishing it right in the hallway if it was serious enough, or where we get to our evacuation site is where we're going to have to continue. Okay with that? Any questions on that? Now this isn't rocket science, it's just everybody's got their own little part. Okay, the control desk, if you're there, you may pull the alarm, you can notify the charge nurse. There's, again, just helping out here, clearing the way. It is recommended that if you can go to another OR, as long as it's safe to do so, you can do that too. So typically the control, you know, they know what's going on. They can see open ORs, they can see everything that's happening. You can meet the firefighters as well. Okay, so like sterility, right? Like if you have a significant fire, sterility's out the window. Sorry, right? Like that red line, they may void that and just, they may, because they got to take care of your problem. And if they don't take care of your problem, it becomes worse, okay? All right, charge nurse, again, like it or not, if you're a charge nurse, you just accepted responsibility. So one of the first questions, right? Where's the fire? When they arrive, they should be asking. Number two is, hey, is everyone accounted for? Where are all of your people? So we need to take a head count, right? Oh, yep, okay, I got, all right. I'm missing, you know, Andrea that day. I can't find them. Maybe she was on break or whatever. So again, where's the fire? Is everyone accounted for? We're getting doors closed. Is everyone safe? Things like that. Again, before we evacuate, if the hallways are clear, we may, you know, you may be forced to evacuate based on what's going on in the actual surgical setting, okay? I can't remember from last year, do some of the rooms share a sub-sterile space? Okay, there's maybe like a swinging door in between. So the odds are that if there's a fire in one, there's no firewall, there's no fire doors in between. So if the fire's in one and it shares that sub-sterile space, the odds of you having to evacuate, even though there might not be a fire, are high. Okay, they may say, you know what, there's a fire, the sprinkler's going off in this room, water's traveling, right? So guess what, you're gonna have to evacuate too. Now with this comes, there could be a fire in one of the ORs that's across the hallway. Okay, we're not connected, but we've got, you know, we're okay in here. If there's smoke in the hallway, nobody goes anywhere. Again, the ventilation system is shut down, so it's not drafting any smoke from anywhere. So it's gonna linger for a little bit until the firefighters, until they can get here to clear some of that, right? We may have to hang tight for a little bit. No cases, no new cases should start when we have a fire in the building, right? Actually anywhere in the building when the alarm is going off. Just hang tight for a couple of minutes, okay? So here's what your floor plan looks like. So if we were to cut the floors, right, cut the roof off, and we're looking down, so here's how we're gonna evacuate, like cath lab, okay? ORs 1 and 2, we can evacuate beyond those firewalls, beyond the fire doors. ORs, you know, 5 through 8, again, we're beyond that, so we're just gonna move and we're gonna flip-flop back and forth based on those conditions. Okay with that? Any questions on that? Okay. Where we're gonna meet the firefighters and we're gonna direct them, so if they're gonna start dragging hose, right, like I'm okay with, hey, we had a piece of equipment that was sort of malfunctioning, we turned it off, we unplugged it, we're okay, right? Like I'm okay with them coming in the front door even. But if they're gonna put hose down, this is the important part here, is we're gonna have to direct them in through this door, or not for nothing, we may have to direct them in through here and they have to snake all the way through the building to get to one of the ORs, okay? So it's important that we actually have them not prop those doors open. Make sense? Okay. First floor, a little bit different. Again, I think that's surgery center. That may be surgery center. Yep. Never mind that. Unless there's folks that work out there. Yeah, they're built.
We have surgery center.
You do have surgery center. Okay. So at some point we'll talk about that here later on. Again, the concept is still the same with the walls. We're just flip-flopping based on where that fire is.
Do they have any compartments in the OR?
Somebody
Can you
has
show
something?
them if they have a compartment in the OR? Can you explain that to them?
Yes. Help me out here because I don't remember. This is main entrance. These are procedure rooms here. So again, you can't stay in this space if there's a fire in any one of these rooms. So we're gonna have to move, right? So typically what we would do is we would go from this procedure room to this procedure room, if it's available, okay? And we're gonna flip-flop back and forth. Okay, answer, is that okay? Sort of clear as mud, okay?